This video demonstrates how to perform bedside cleaning of flexible gastroscopes and colonoscopes. First, gather the needed supplies, which are the first step bedside pre-clean kit, sterile water, an air-water channel cleaning adapter, and for any scope with an auxiliary water inlet, a luer lock syringe, and the endogator that comes in the package of disposable buttons. Be sure to wear appropriate PPE. For colonoscopes that have the variable stiffness control, ensure the variable stiffness rings, 2 marks, are aligned so that the variable stiffness is off. Turn the video processor, light source, and CO2 source off. Prepare the bedside pre-clean kit by filling the pouch with 500 milliliters of sterile water. Using the detergent-soaked sponge inside of the pouch, wipe down the entire insertion tube of the scope from boot to distal tip. Turn the suction source on. Make sure the cap to the biopsy valve is closed. Immerse the distal tip of the endoscope into the detergent and press the suction valve to aspirate the detergent. For any scope with 190 in the model number, only 10 seconds of aspiration is required. For any scope with 180 in the model number, 30 seconds of aspiration is required. Remove the distal tip of the scope from the detergent and press the suction valve to aspirate air for 10 seconds. Turn the suction source off. Remove the disposable air-water valve and attach the reusable air-water cleaning adapter. Turn the light source on. Turn the airflow regulator on and make sure it is set to high. Immerse the distal tip of the scope into the detergent. Press the air-water cleaning adapter. This will flush the air-water channel with detergent. For any scope with 190 in the model number, only 10 seconds of flushing is required. For any scope with 180 in the model number, 30 seconds of flushing is required. Release the air-water cleaning adapter for 10 seconds. This will flush the detergent out of the air-water channel. Turn the light source off. If the endoscope has an auxiliary water inlet, attach the endogator to the inlet and flush the inlet with 30 ml of detergent. Detach the syringe, fill it with 30 ml of air, and flush the inlet with 30 ml of air. Remove the disposable components from the endoscope. Place a dirty scope tag with a patient sticker, physician who used the scope, and date the scope was used on the dirty scope. Then place the scope and all reusable components in the scope container. Write the time of bedside cleaning on the dirty scope container lid. At the end of the case, transport the scope container on the case cart with other dirty instrument trays to be reprocessed by SPD.